Kia ora koutou and welcome to eHealthTALK NZ. I'm Rebecca Macbeth, I'm the media editor at HINZ, and today I'm joined by the Chief Executive of the Digital Health Association, Ryl Jensen. After 4.5 years leading New Zealand's peak industry body for digital health, Ryl has decided to step down. So I'm sure all of our listeners already know you, Ryl, as you certainly get out and about, you're advocating for your members and for digital health around the country. But if you can start just by telling us a little about yourself and how you came to be the CEO of the DHA.
Sure. Kia ora, Rebecca, and kia ora koutou to all your listeners. It's great to be here. Thank you so much for having me. I think it's been one heck of a ride being at the helm of DHA. I come from a digital background in my earlier career. And so I worked for organisations like IBM, EDS. But I think what really interested me in health and what led me down the health path was being embedded in the health system with my family. So this is the part that people might not know. So we have 2 children. Both of them are fairly grown up now, but when they were young, they had a lot of health issues, and especially my daughter. Then also I got sort of thrown into the health system as well. So I had secondary infertility, and that was a real battle to get on top of that. My particular infertility was man-made, which was a bit unfortunate. And as a result, I became a very strong advocate for this condition known as Ashman syndrome. And I worked with a whole bunch of doctors around the world and people around the world, and we worked towards it being IR35 charitable status in the US, and we founded the International Ashman's Association. So I guess that was my first sort of role in advocacy, really. I was on the very first board of directors. We worked with some amazing people, some amazing doctors at the time who were really good at what they did and helped so many women. And so at one point I decided I wanted to combine the two, three really, advocacy, which I was really feeling quite passionate about, health, and also IT. So I went back to uni, got my Master of Health, and during that time I started doing some papers around digital health and comparing Estonia's digital health system and New Zealand's digital health system. Met Scott Errol at the time, who was CEO of NZ Hit. We were slap bang in the middle of COVID. He used to have his coffee catch-ups, which I see he started up again. And I joined those. And then the NZ Hit Health Tech Opportunities report came up, and I said, well, look, I'm about to finish my semester. Why don't I help you write it? And so that's what I did. I helped the team, Malcolm Pollock and Mark Cox, write that report. And from there, they said, Ryl, why don't you apply for Scott's job? And I'm like, really? No way. Who would employ me? I don't have enough experience. But they said, no, we need good people. And so I thought, okay, well, why not? So I put my hat in the ring. And I met with about 6 or 7 of the board members, went through a very rigorous interview process, and was offered a general manager's position. And so I started in April 2021. And then within 6 weeks, the CEO role had become vacant, and they asked me to step up as acting. And then the rest is history.
It's so interesting. So many people have a personal story that brings them into the health system. And it's obviously one that's kept you there and what makes you so passionate about making things better. So over your time as the Chief Executive, what are the biggest shifts that you've seen in New Zealand's digital health landscape?
Yes, I'm going to be actually quite honest here, Rebecca. I'm going to say that not all the shifts have been positive. And last year, I think, when I sat in the Speakers Gallery and listened to Budget 2024 and then pored over those documents, and you and I converse on those days, and we're both trying to get media releases out and things, it was rather devastating, actually, to see that 380 odd million reprioritised and go towards something else. So I think that has been a negative shift for the sector, but also potentially there will be some positivity that will come out of it. We have been through a long period of consolidation with staff and restructure, which I think has been hard. So we've lost a lot of time. And I think that's probably one of the hardest things is there's been time lost in terms of moving our health system forward and the benefits that digital health can provide. So fast forward to now, we're actually starting to see some really good positive signals from government, and the restructure is settled now, and we can all probably start to move forward. There's still not a commitment to funding at this stage, but I'm ever hopeful that Budget 26 will bring some really good news for everybody. Now, in terms of the good stuff, well, there's a lot of innovation happening around the edges. So people have been forced to just get on with things, right? So you survive or you thrive. And I think some people have just been surviving during this period, but then others have been thriving as well. And so we're seeing some really good things happen around AI with GPs and transcription. And so we have seen time-saving technologies like that are relieving some of the pressure for our GPs and potentially moving into our hospitals as well. And then now we've seen the South Island basically fully connected, which is a really great move. We've seen some hospital in the home pilots. We have looked at digital mental health. So we've had some really good advancement with Minister Ducey around progressing that, and he's asked for a digital mental health roadmap and the sector to come together. Unfortunately, I won't actually be able to finish that project, but it is only 2 months away, and the team that are actually going to be finishing that I really have a lot of faith in. So there's lots of really, really good things that have happened. There's lots of collaboration that's happened. There's lots of members coming together that has happened. And I also think that there's been a really good stock take. So where are our weak points and where are our good points and where's the good innovation? I think the private sector is moving ahead quite well. So lots going on, but not all of it has been positive shifts, because I'm not going to paint it all roses, but then there's a lot of positive stuff as well.
Certainly AI is the thing that's causing the most interest and positivity at the moment. But at our recent AI summit, I thought the most interesting comment was one of the nurses who said, well, she was going out and talking to some other nurses about maybe using AI, and they were like, well, you're sort of jumping the gun here because some days my computer won't turn on. So, it's exciting to talk about AI, but you've got to have those fundamentals in place, don't you? You've got to have
100%.
building blocks for it to work on. So, you kind of got to do the two in tandem, which is not always easy, especially from a funding perspective. So you've worked closely, as you said, with leaders across public and private sectors. So are there any particular approaches you've seen that have led to real change in data and digital?
Look, I think that over my period, what I've absolutely loved doing is bringing the community together. And so there's been a change in the way that we all work together, and there's been a change in how we communicate with each other as well. And we've grown a really strong tie for that communication to happen between government and industry. And I think that's probably one of the key things that we needed moving forward. And none of us are going to survive if we don't talk with each other, if we don't actually collaborate with each other. So it's really important to lock in those approaches and keep working on them as well, because they're never perfect. My favourite approach really technically was NHIP. So it was known as the National Health Information Platform. It evolved to HIRA. It was a troubled program in many ways. And in the end, it ultimately didn't survive the test of time. But the actual basis and the actual foundations of HIRA, I still believe, are what New Zealand needs in order to connect all of our disparate systems. So we still see a lot of lack of communication in between wards or in between departments in hospitals, and then we see that lack of communication between GPs and between the primary care sector and hospitals. We're starting to get better. So Pacific Radiology, that's our biggest radiology provider, GPs can now refer straight through electronically. You can actually book online. There's some really good things that have happened, and tech has enabled that as opposed to slowing it down. But there's also examples where tech does slow doctors down. And we were recently seeing some specialists for my daughter, and the Wellington region now has a single clinical portal. But the doctors and the specialists say to me, it takes about 2 minutes to boot it up, and then it takes a long time to find what I'm looking for. So while they can see the DHB data, it really slows them down and it's not necessarily working to its capacity. So I think there's lots of good approaches to many different things. My favourite would be the connection, the community working together to be able to try to solve some of the problems. For us, for industry to be able to go to government and say, hey, this is broken, or this is not working, what can we do to fix it? And then for government to be able to say, yep, let's look at that. So I think it's just about opening up those channels. That's probably my favourite advancement.
Yeah, I mean, listening to the problems of the community and their ideas for solutions is not a revolutionary idea, but it works time and again. Especially, yeah, often I speak to providers on marae and they're doing all sorts of interesting things just because they speak to their whānau, they speak to people regularly, and from there they look to find a solution. And so often it's exactly what that community needs. So the health sector has faced and continues to face huge challenges in recent years. So how have you and your members coped with those?
Oh, yeah, I think I mentioned this before. Some have just gone ahead and innovated, and some have kept knocking on doors. Some have looked to overseas markets, which I think is absolutely vital when we're in an economic downturn ourselves. There's been a lot of cost cutting, and that has actually really hurt digital health, probably almost the hardest hit across the health system with the change. I think also the change to the single body, Health New Zealand, has been a hard transition as well. It hasn't necessarily had the right structure behind it, and I'm hopeful that now we're moving forward into a different phase for it. The idea behind it was a good one, to stop the postcode lottery and for everybody to be able to work together in single procurement practices. But often that actually tripped things up as well, because nobody knew where to go anymore. Nobody knew who to talk to around, well, where do I get my bill paid? Or how do I actually approach you about an idea that I've got? And who's looking after procurement? And then all of those sorts of things. So we're moving through that now. But those challenges are still right in front of us, and they still need to be overcome. And I think we are still very much a siloed health system, and we're still working regionally and still working within our DHB models as well. I see the South Island sort of taking those few leaps forward and becoming more of a, Te Waipounamu altogether, and we want to see the same thing happening in the North Island. We've got the N4, which are the big four primary health organisations joining together now to look at bringing Health One to the North Island. And then there's been a new program of work which has been found, has got little funding at the moment. The Shredder, as its nickname is, or Shared Digital Health Record, which will be the grandparent that will hopefully bring all of these shares together. So the challenges are real, and I think the biggest challenge is around funding. And I think the biggest challenge is around convincing government that this is the right thing to do for productivity, for efficiency, for patients. Recently, my daughter was in hospital. She had acute pancreatitis. The best digital process for us was when we rang Healthline, and Healthline then did a triage and then called an ambulance. And so that was automatically connected. And then that notification that we'd had an ambulance called went to our GP. But from there, it stops. So the GP doesn't know why she's gone to hospital and when she'll be out or what's happening while she's there. And so that's where we need to connect more. And then while we were in hospital, the paper trail was outrageous, and it just slowed everything down. And we got asked the same questions over and over and over again. And nobody really knew. So you'd get a new doctor, you'd tell the story. You'd get a new nurse, you'd tell the story. And so it just actually slows everything down if we don't have those digital systems. So I think we still have a lot of challenges that we face regionally, locally, and nationally. There's a lot of really passionate people that want to take this forward. And there's a lot of really amazing technology. Our members have got some phenomenal tech that can help solve these problems, but we really need those with the checkbook to understand that these things don't just happen overnight, and these things need to have dedicated ring-fenced funding. And in order for it to move forward, they actually need to be given some time as well. So time is a critical factor. So if you stop a program and then you start it and stop it and start it and stop it and start it, you actually can't move forward. And so always reviewing is good, but don't stop the momentum and keep going. Always ask yourself, are we still solving the problem that we set out to solve? And if not, rejig it. But losing the funding, losing the time, and stopping the program is very hurtful for progress.
Yeah, I completely agree. And I mean, the South Island as well. I had my own experience of my mum going in and out of hospital there, and the difference there of having Health One access, but also they were using Cortex notes. So it was paperless in the hospital. And there were so many times where I was able to ask a nurse a question who hadn't been on shift when something had happened, and she was able to check the notes and come back and tell us, or even call. Sometimes I wasn't there and they could tell us. And I just thought it was unbelievable, not only the clinical impact, but the impact on family of stress, of not understanding what's happened, which is completely intangible. You can't measure it. How it affects their day and their work and everything. It just ripples out when hospitals are a stressful place to be. So yeah, trying to make them more seamless is always going to help everyone involved. So I was very impressed when I was in Christchurch Hospital. So it's always something, like you said, you've got to just concentrate, who are we doing this for? What is the point? And it's for the patient and their health and their whānau. Yeah. So you've also represented Aotearoa on the world stage in New York. That must have been very exciting. Can you just share some trends or innovations overseas that you think we should be paying closer attention to here?
Sure. So, I mean, look, that was exciting. It was probably one of those pinch me moments. So, and this is about saying yes to things, right? So my first trip was with Enterprise Island, and that was a huge, big health tech conference that they brought in buyers from around the world. So you had Mayo Clinic and all those sorts of people there. And we hopped on buses, went to Galway, had presentations at innovation hubs from all of these awesome, digital or medical technology companies. And so therefore it starts to sell the tech from Ireland. And as we know, Ireland is very good at doing that. But from that, I met Martin Curley, Professor Martin Curley. He really loved my thesis. He took me to see the Secretary General of Health to talk about my thesis. And then when I got home, he said, "Ryl, would you like to come to the UN?" And I'm like, "What do you mean the UN? Really? In New York?" And so actually we went out to members and we fundraised for some sponsorship. So I'm exceptionally grateful for that. And that was just a moment where we were all collaborating to try and sort some global direction for digital health. Out of that was born the Manhattan Manifesto. And within those 12 key principles, 2 of those are directly related to my thesis. So that was a really proud moment. And then Professor Martin Curley has coined the term stay left, shift left, 10x. And stay left is about keeping people at home for longer. because people recover better when they're in home rather than in hospital. If you do land in an acute situation, then let's get you home as quick as we can. And all of that can be done through 10x technology. So you not only need the 10x technology with remote patient monitoring in the home, especially for chronic conditions, which again is vital for whānau to know that they're supported as well, not just the patient. But also it's about managing and giving the space to clinicians and hospitals where there are extra beds and they have the time, and also giving them the 10x technology too in order to get through what they need. But it has been such a privilege to be able to go overseas, not once but twice, to New York, to really work with colleagues from the World Health Organization, from the ONC, lifting standards, and also even the World Economic Forum. There's lots of really amazing things happening out there. So the second part of your question was what's going on. So the Aussies, our good friends, the Aussies, they have really grasped digital health and the importance of it in the last 2 to 3 years. So not only has their government funded it, so there's been a really big, massive boost to funding, but they also founded Spark.au, which really has put the momentum behind FHIR and standards uptake, which we all need to sort of follow for interoperability. And then they are really homing in on their My Health record and ensuring that everybody does have the ability to upload or find their health records. They've got an app on their phone now. And then most importantly, they've looked at legislation. So in the same way that the States is run with 50 unruly states, you've got governors and you've got your own governments within each state. And Australia is just as complex because their states fund the hospitals, but federal funds primary. So you've got this sort of disconnect at times. And so legislation is often one of the only levers that you can pull. And so they've also pulled that sharing by default legislation, which means that doctors or clinicians have to upload a certain groups of data. And so I think the Australians are moving forward at pace, whereas we were once considered in front of them. I think we'd probably consider ourselves a little bit behind again now. And that's just the ebb and flow of everything. And then the UK, they have just put 8% of their health budget behind digital. I think that's phenomenal when, Rebecca, your analysis told us we only spend 2.2% here in New Zealand, and that barely keeps the lights on. So there's a really big disconnect. But I think overseas we're seeing digital and digital hospitals built and innovation hubs built where you've got researchers, innovators, and clinicians coming together. I think those are the sort of the trends that we're seeing overseas, and we would do well to do that as well. Dunedin Hospital is a really amazing opportunity to have an innovation hub there, to grow the one in Auckland already, and to move forward. We've got 5 million people. We've got a diverse population. We've got 20% Indigenous people. That gives us world-leading data and world-leading ability to create programs that really work well for some of our more vulnerable communities. We've got lots of rural, flung out in lots of places. We're not hugely densely populated apart from Auckland. So I think we've got a massive opportunity, but sometimes we don't get the funding or the oomph behind it to be able to move forward as fast as we'd like.
It was interesting at the recent MTANS conference where Lester Levy, the now chair of the board, but he was commissioner, spoke, and he spoke for quite a while actually. And the one thing he said was, he was saying digital is the only way forward in terms of the sustainability of the health system, but talked a lot about if there's no new money, you have to decommission. So where's the money going to come from? And that's kind of the sticking point, isn't it? And how it's very hard to take things away from a system like that. So we shall see. He's speaking at Digital Health Week in November. So hopefully you'll have something new to update us on.
Keep an ear out for that, won't we?
Yeah. Yeah. So for people who are starting out in the digital health space, most people don't start out thinking, I want to work in this area. They sort of
Mm.
stumble into it somewhat the way you have. So, but what advice would you give to people who know they do want to get into digital health and who really want to make a meaningful contribution?
People do sort of evolve into it, but there are now plenty of courses that you can do. So there are now postgrad courses you can do with digital health. And the thing about any kind of postgrad study is that you get to choose your own topics. And so I was a non-clinician going into a postgrad study, and in the end, it led me down the path of learning about digital. So there is a lot of programs out there. I think just having a desire, like what is it that you want to try and do, understanding, well, where do I want to make the difference? And that could be just as simple as you want to make a difference on your ward or within your practice or somewhere like that. Or you could be thinking much bigger in that you want to be a change manager or you want to work in procurement of digital health. And so I think it just depends on the person, but really good people are needed. And I think if you have a little tiny bit of curiosity, you should explore that and talking to people within the sector. So knock on people's doors and just start talking. Going to Digital Health Week, attending the quarterly Hui and all of the other DHA events, and attending all of your events as well. I think those is what opens you up to those possibilities. And it's certainly what opened me up to that possibility. You can take a very deliberate path, go back to uni, or you can do both, deliberate and talking, or you can actually go do the talking side if you have some curiosity around it.
Yeah, they're certainly a very welcoming community. I've always thought that about New Zealand's digital health community. Always been very kind and willing to give up their time. So just finally, and we'll have to keep it short, but it's a pretty big question to answer in a short amount of time, is what's your vision or hope for the future of digital health in Aotearoa?
I think my vision and hope for the future is exactly the same as when I first came into this role, Rebecca, is that we're all connected through digital, that whānau have access to their records, that whānau can help their whānau manage their health as well, that we have much more control over our health and well-being with that, that we lift our clinicians and we support them with digital processes and communication and the ability to understand what is going on with the patient, which ultimately helps our patients. And I think just having that fully connected community, really productive, being able to manage people much more in the home so that we can move to this stay left, shift left 10x paradigm, which is not unachievable. That GPs know exactly what's going on with their patients if they land in hospital and vice versa. And that we actually don't waste resources anymore because we repeat scans because we can't see the scans. And that we all do this together. That's probably quite fanciful because, digital health is a competitive industry and everybody is trying to pay their mortgages and their staff and want to make the most of it. I'd really love to see New Zealand on the world stage as well. We can advance and sell it to the world. So there's the economic side as my vision, lifting New Zealand's economic prosperity. There's allowing our patients to take more control of their health and well-being. There's enabling our clinicians and our whole work staff from dentists, physio, occupational therapists, everybody's connected. And then being able to just really wrap that around a really unique New Zealand flavour that we can take to the world. So, yeah, I just want to care for our people. I think it's the same vision when I came in. I have a true belief that we can get there. I think we've got some amazing people in the sector, truly, a lot of heroes and a lot of really innovative people that just think outside the box. And we just need to keep doing that. And then we need the government to support it to really understand the benefits.
Well, on that inspiring note, Ryl, I'm going to have to wrap it up. So thank you so much for joining me today. And yeah, HINZ wishes you the very best for whatever comes next.
Yeah, I have absolutely loved collaborating with my HINZ colleagues. You guys are true champions, and I wish you guys all the best too. I'm going to miss you. I'm going to miss everybody in the sector. It's been one hell of a ride. In fact, this is probably the bit where I feel a little bit teary about saying goodbye. So thank you. Ka kite anō.
Mā te wā.